This is Average Joe PT. Now today, Scully and we're going to talk a little bit about the spine. It's been a while since I've talked about the spine, but I'm going to go over some of the basics that you can have issues with in your back. And let's start with the lower part of our back. So stay tuned. Now Scully, now we're talking about the spine, right?
Yes, we've been talking about that spine forever.
Yes, we've talked about this, but I've had people come up to me all the time, and the number one thing they're going to ask me about after probably a shoulder or neck pain, they're going to ask me about their back. Once they know I'm a physical therapist or in the medical field, they're going to ask about the spine. So I'm going to go over the basics about just the spine, and if you have some pain, what the heck's really going on? I'm going to zoom in like I always do with my handy dandy little model here. And looked at it. I said we pulled one of these pieces of the spine off, boom, and we showed it right here. We have the disc, and you have the nerves coming right off the back side of it here. Now, what happens as we age, there's a thing called degenerative disc disease that gets thrown out there all the time with the chiropractors, right? Right, Scully?
Those crazy chiropractors.
That's right, those crazy chiropractors. They'll say, you got disease, you got a disc disease. All that really means is as we naturally age, the fluid within the disc space actually starts to be less. So instead of having a nice space between the two bones, they start to kind of flatten out a little bit. Now what that does on the backside is it increases the stress on these joints right here on either side, and these are our facet joints that we've talked about in the past. I'll leave a little link up here that you can go to all about the spine and all the different types of treatment techniques that I've talked about, whether it's ice or TENS unit or whether it's massage techniques, anything like that. But the major one that I see all the time is sitting. Now when we sit, we want to stay away from this C-type sitting position. We want to sit with our nice 3 curves in our spine that we're supposed to have, okay? And so we want to be having our nice, especially on this lower part, nice little curve here. And if we don't, we're sitting like the letter C, and you can see, no pun intended, right, Scully, no pun intended.
Oh my gosh.
That it puts a lot of stress on those joints and the disc over time. So what we want to do is when you have to sit for long periods, make sure you're getting up throughout the day or icing when you go home and staying away from sitting when you go home. You don't want to sit all day at work and then come home and sit more and think that your back's going to feel better for that. It's not going to. We want to get out of that sitting position, icing it, and then when you are sitting, make sure you got something behind you so you can keep that curve so you're not flattening or rounding out your back into a letter C position. That's probably, what would you say, Scully?
Yeah, about 90% of the time.
Probably about 90%. I don't know if it's that high, Scully, but it's fairly high on what's causing people's back to keep flare up. Naturally, we have all types of healing properties in our body that can help us with this problem. If we calm down the inflammation in the joint, as well as anything that's causing pain around the joint, because this bone here, this vertebrae above and below, they both have nerve endings in them. It's called end plate nerve endings, and they can get inflamed too. But most of the time, if we can get the inflammation to calm down by stopping the activity that's caused the issue in the first place, ice it, rest it, and give it time to heal instead of really irritating it again. I call it picking at the scab. If you continue to pick at a scab, it's not going to heal. The same thing with a problem with your spine. If you continue to do the same thing, it's not going to heal either. That's almost common sense, right? So cut that inflammation to calm down, and all of a sudden your back symptoms will be a lot less. Now it's going to probably take a couple weeks for that to really calm down. You know, the doctor might give you some muscle relaxers, some painkillers, and tell you just to take it easy for a few days. That's the acute phase, that first 72 hours. Realizing it's going to take your spine quite a while longer to really recover depending on how bad you've irritated it. We start talking about nerve issues, that can even take even longer because nerves are very angry. When they get angry, they can take even longer to recover. So if you have any questions, you can always shoot me a little down below comments. And positive, negative, whatever it is. If you want to subscribe, that would be great, right, Scully?
Subscribe, please. Go ahead and subscribe.
Yeah, maybe if I get enough subscribers, we can actually upgrade Scully, because I've been talking about that since, a year in this crazy pandemic. But anyways, if you have anything else to add, go ahead and leave it down below. Otherwise, Scully and I want you to look up and keep smiling. See you next time, folks.